Hello. Happy Monday, everyone. I'm Rendy Murphy. I'm epidemiologist and director of disease surveillance at the Mobile County Health Department. This is the first day of March, March 1st, 2021. I think we're at week 51 of our COVID outbreak response, coming up on that infamous one-year anniversary of our first COVID cases reported in Alabama and Mobile County. Of course, we are still seeing, strong impacts from the COVID pandemic across the world, and Alabama and in Mobile County. We have a lot of numbers to get to today, so I'll skip the world numbers and just go straight to what we're seeing in Mobile County today. So the number of COVID cases reported to us daily is still quite low, except for one artificial spike that we saw last week. So yesterday, 36 cases of COVID were added. On Saturday, 54 cases were added, and then on Friday, 110. So we often see a slow start after some closures over the weekend. So we're reporting today on 36,242 cases of COVID-19. We had 2 additional deaths reported to us yesterday, bringing our cumulative number of COVID deaths to 728. The cumulative number of people hospitalized is 4,657. 6 were added yesterday, and the number of people in the hospital yesterday with COVID-19 was 85. So it's very encouraging to see that we have been below 100 people in the hospital on any given day with COVID-19 for 5 days in a row now. So that is really good news. So keep doing what you're doing, wearing your mask, avoiding gatherings, staying at home when you're sick, washing your hands, all of those things, so that we can hopefully keep COVID numbers down, get them down and keep them down this time. And it's going to take all of us, continuing with those prevention measures and then getting vaccine when we have an opportunity. So our weekly expanded report this week, again, all things looking pretty good. If you look at just the number of cases added by infectious state, we were at 370 last week, which is low as it's been, since early September. So again, really good to see the numbers of cases going down. Let's see. We still see the highest number of cases reported in that the 25 to 49 age group. So really, that's what's driving our transmission. Those, the 18 to 50 age groups are where we see most transmission. The moving average number of cases and people hospitalized is going down, has continued to go down for, since the early January. That's really good. Emergency department visits for COVID-like illness are as low as they have been in some time. And we're finally starting to feel better about the number of deaths related to COVID tapering off. Remember, there's a lag. So when we see a really high number of cases like we did in December and January, the number of hospitalization lags, and then the number of deaths lags behind that. So we're starting to see that come down nicely as well. The percent positive test results, so the number of positive test results divided by all test results, was below 7% last week, so that is good news. We're still seeing a lot of tests being conducted. That's great, but the percent positive is going down. We're still sort of in a little bit of limbo with regard to, when we look at the school risk indicators, where we have localized outbreaks. We have 301 new cases per 100,000 over the last 14 days. We have an increase of 50% in the amount of cases seen over the last 7 days in schools. So still sort of for those of you that look at those school indicators, it's important just to remember that we still have, pretty good chance of COVID transmission. But we've been seeing in the literature that generally is reduced in the lower ages. So it's probably not a surprise that older teenagers that can drive and move about without a lot of restrictions may tend to gather more and maybe have more transmission there as compared with, middle schools and elementary schools and pre-Ks, that sort of thing. So some updates to give you. So Alabama published a little update today, and it's got some encouraging news. So they're saying that the average number of vaccines, COVID vaccines shipped to Alabama per week is up to 140,000 doses. That is almost twice as much as as Alabama had been receiving just a few weeks ago. Part of that is due to the approval of the J&J vaccine. So as many of you know, the FDA issued emergency use authorization for the Johnson & Johnson single-dose COVID-19 vaccine for individuals 18 years of age and older. And Alabama will receive its first allocation this week, just over 40,000 doses. So this will be sort of a one-time allotment. Not sure when the state might get more Johnson & Johnson vaccine, but it won't be used to target a specific population. What the state health department has been doing is they kind of have a grouped approach to providers. So when Pfizer came out, it required that -80 cold storage. So mostly hospitals had that capacity, so the Pfizer vaccine went to them. Then when the state started receiving Moderna, there were many more providers, including county health departments, that could store the Moderna at -20 in the inventories that we were receiving. And now that the J&J is out, it requires just normal refrigeration. So there are lots of providers out there that can refrigerate, but they cannot freeze. So it's thought that the J&J allocation will go to those folks. So it's not a whole lot, just 40,000 doses, but it's a great thing that Alabama is going to receive a total of around 140,000 doses just this week. So good news. The total number of vaccines administered in Alabama is just over 920,000. So that's how many shots have gone in arms. So a mixture of first dose and second doses. But really good news that vaccine seems to be, the number of doses that we get in Alabama seems to be increasing. Also wanted to mention that you may have seen in the news that select CVS pharmacy locations are now receiving COVID vaccine information and are taking appointments for COVID vaccine. I believe there are maybe 10 or so in the state of Alabama, and one of those is in Biola Battery. So go to cvs.com and look for, if you're eligible, and look for appointments at the CVS in Biola Battery. We really happy to see vaccine going into that underserved area. So that's really good news. So just to remind you that, it was 4 weeks ago when the state had a extra push of allocation where there were 8 locations throughout the state trying to get 5,000 doses out. They far exceeded their goals. So this week starts the second dose for all of those clinics. So there will be a lot of second dose clinics this week. In fact, we have several second dose clinics this week, and let me just tell you a little bit about them. So tomorrow, the second dose vaccine clinic for vaccines given on February 2nd at our Sims Health Center location. We're going to give the second doses for those people at the cruise terminal tomorrow. So the weather is really too inclement for us to do drive-through vaccination. So if you were vaccinated on February 2nd at the Sims Health Center, you are eligible to receive your second dose tomorrow at the Alabama Cruise Terminal at 201 South Water Street between 9 and 2 p.m. There's no need to line up super early. Your dose is reserved for you. Your second dose is on hand. So please do not come to the cruise terminal unless you received your first dose at the Sims Health Clinic, the Mobile County Health Department Clinic, on February 2nd. Again, tomorrow, 9 to 2. Second dose clinics. We also have second dose clinics planned this week, March 3rd at our 8 Mile clinic, on March 4th at Citronelle, March 8th in conjunction with our Mount Vernon location at Belsall Middle School, and then later in March back at the cruise terminal. So again, lots of second dose clinics going on this week. And super excited to see that many people who are going to be finishing their series and will soon be protected against COVID. So that's really good news. We did have a very successful first dose clinic in Saraland over the weekend. in collaboration with city leaders and Redemption Church. So we're very thankful about that. It was a little warm and muggy, but I think everyone was happy to get their vaccine. So I think, oh, and just another thing to mention about vaccine. We talked about J&J now being improved, but the Pfizer vaccine, an important announcement was made this week that FDA is allowing undiluted frozen vials of Pfizer vaccine to be transported and stored at conventional temperatures commonly found in pharmaceutical freezers for a period of up to 2 weeks. So this may mean that more providers will be able to order and receive Pfizer vaccine. Not really sure how this is going to work out, but it's good news because we've heard that Pfizer has been ramping up production of their vaccine, and the fact that it can be stored for up to 2 weeks at a normal -20, sort of a conventional laboratory freezer, is really good news. So let's see. All right, couple questions. Someone asking about the J&J vaccine. Do you know when it'll be in Mobile County? I mentioned that the Alabama Department of Public Health is expected to receive 40,000, just over 40,000 doses of the J&J vaccine allocated to them this week. I don't know how those will be distributed. Hopefully some will be distributed across the state and come to Mobile County, but we're not sure. It likely will go to providers who do not otherwise have capacity for frozen vaccine storage. Since it requires only refrigeration, that's what I think. That is a total guess. I may be on here tomorrow saying that was completely wrong, but that is my guess, that Pfizer's going to go to ultra-low cold storage facilities. Moderna is going to go to those who have capacity for a -20, and then J&J will likely be distributed to providers that have neither of those ultra-low cold storage, because the J&J can be stored in the refrigerator. All right, here are some questions from our online vaccine information page at mchdcares.com. Someone asking where to go find information about weather cancellations and reschedules. So the place where you entered this comment is where you go to find information. So mchdcares.com will have the information as quickly as we finalize it. You know, sometimes the weather changes quickly. So this morning, when it looked like, we realized that the weather tomorrow is going to be bad on our 8 o'clock call, we realized we needed to reschedule and got right on it and made the decisions and got the information posted as quickly as we had it finalized. So go to that mchdcares.com to find information about cancellations and reschedules. Or if you don't have access to the internet, you can call 251-410-MCHD. All right, the other question here is, how do you find your lot number? If there's an issue with the vaccine, will you be contacted if your lot number has an issue? So your lot number is written on your contact card, on your CDC card, your COVID vaccine card. I should have brought one so I could show you. But your lot number is written on that card. So if you I've not heard of any issues with any lot numbers. I mean, there was some rumors of some issues a couple months ago, but those were kind of dispelled. But yes, if there is information to provide about a particular lot number, we will let you know. All right, and then someone that's really looking forward maybe to another holiday and asking me what I think about people gathering on the St. Patrick's Day holiday. And again, non-work gatherings are prohibited unless 6 feet of distance can be maintained, and then masks must be worn if you're in an indoor setting or any outdoor setting that does not facilitate 6 feet of distance. So whether it's a birthday party or St. Patrick's Day or Mardi Gras or a prom or a wrestling match, the answer is the same. Gatherings are a bad idea because they are a potential super spreaders. So they definitely, anytime you gather with someone who does not live in the house with you, you raise your risk of contracting COVID-19. You can try to reduce those risks by wearing a mask and staying at home if you're sick and maintaining that 6 foot of distance. But again, the mask order is still in place through the end of this week. We expect the governor to make an announcement about whether or not the mask order will be extended in the state of Alabama. I hope that she will extend the mask order. But again, anytime you're gathering around people who do not live with you, you increase your risk of COVID transmission. So wear your mask, wash your hands, stay at home if you're sick, get vaccinated. And we will be here again tomorrow to bring you a couple updates about how our vaccine clinics are going, and any updates about rescheduling or inclement weather that might result in changes to our schedule this week. So stay tuned. We'll see you again tomorrow.